Good afternoon. You look so out of breath. Are you okay?
No, doctor, I'm having difficulty in breathing.
Let me check your arterial oxygen. It's a little bit lower than normal. Don't worry, I've already ordered oxygen for you because the nurse already told me earlier that you're having difficulty in breathing. The oxygen should be here any minute soon.
Thank you, doctor.
Aside from difficulty in breathing, what are the things that are bothering you right now?
I'm also having chest pain.
I see. So is it manageable?
No, doctor.
Could you tell me exactly where the pain is?
It's on my right chest.
Can you still remember when it started?
It started 4 hours ago.
Did it start all of a sudden or gradually?
It was very sudden.
What were you doing when the pain started?
I was reading a newspaper during breakfast 4 hours ago.
Did you experience any trauma recently?
No, doctor.
Is the pain consistent or intermittent?
It's on and off, doctor.
But are you feeling better now or worse?
I feel worse each time I take a deep breath.
What is the pain like? Is it sharp? Dull? Pressure-like? Or is it similar to indigestion?
It's a pressure-like pain.
Is there anything else that makes the pain worse? Like cough or positional changes?
It becomes worse each time I move or take a deep breath.
But is there anything that makes the pain better?
Yes, doctor. I feel a little better each time I take anticoagulants.
Do you have any other symptoms like shortness of breath, cough, dizziness, fever, chills, runny nose, sweating, nausea, vomiting, diarrhea, constipation?
My heart beats faster than usual. I feel dizzy at times together with low blood pressure. My temperature goes up and I sometimes catch my breath.
Don't you feel any weird heartbeats?
No, but my heart beats fast.
Do you have any other illness like cancer, stroke, blood clot, or what we call deep vein thrombosis?
Luckily, I don't have any of those.
What about past illness?
No, doctor.
Have you had any surgeries recently?
No, doctor.
Are you taking any medications right now?
Yes, doctor.
Do you have any food or drug allergies?
No, doctor.
Is there anybody in your family who is experiencing the same symptom?
Yes, doctor.
Is there anybody in your family having problems in the lungs?
No, doctor.
Anybody had a cancer in the past?
My father has lung cancer.
Is there anything that I missed out? Nothing else that you think I should know?
No. I think that's all.
Now, I'd like to examine you a little bit. Is it okay with you?
No problem.
Okay, Mr. Jones. According to my assessment, the most likely source of your symptoms is the so-called pulmonary embolism. It is a little clot blocking your blood vessels going to the lungs. A part of your lungs collapsed, which resulted to the symptoms that you are showing right now. But we are not certain yet if it is really pulmonary embolism. Other possible disorders are pneumonia and pneumothorax. The lungs are covered with 2 layers of membranes, but there is not space between these layers. Once the air gets in between the layers for some reasons, chest pain happens, and that is what you are experiencing right now, which is what we call pneumothorax. It is less likely to happen, but there are still chances that heart problem could be the cause, like myocardial infarction. To get an accurate diagnosis, I'd like to run some tests such as ECG, chest X-ray, and some blood tests. You might also need some more complicated tests later on. Do you have any questions?
Can you at least ease my pain right now? Can you give me some painkillers?
I know that you are under a lot of pain right now. However, giving you any medication will alter your symptoms and it will interfere with the evaluation. It will only take a few minutes. I am trying to give you the best treatment possible. And I promise to give you medication after I am done. So please bear with me. I won't take long. Any other questions?
No.
As soon as I get the results, I'll let you know.
Good morning, Mrs. Johnson. How are you feeling today?
Good morning, doctor. I'm feeling a bit tired, but otherwise all right.
I see. Have you been experiencing any specific symptoms lately?
Well, I have been having some persistent headaches and occasional dizziness.
I'm sorry to hear that. How long have you been experiencing these symptoms?
It's been about a month now. At first, I thought it was just stress from work, but it seems to be getting worse.
I understand. Have you noticed any triggers for these headaches or dizziness?
Not really. They seem to come and go randomly throughout the day.
All right. Have you been taking any medication for these symptoms?
No, I have not taken anything yet. I wanted to see you first before starting any medication.
That's a wise decision. I will need to perform a physical examination and possibly some tests to better understand what might be causing these symptoms. Would you be comfortable with that?
Yes, of course. Whatever it takes to figure out what's going on.
Great. Let's start with a physical examination. I will check your blood pressure, heart rate, and perform some neurological tests to assess your symptoms. Your blood pressure and heart rate seem to be within normal limits. Now, I would like to schedule some tests to further evaluate your symptoms. We will start with a blood test and a CT scan to rule out any underlying issues.
Sounds good, doctor. When can I expect to have these tests done?
We will try to schedule them as soon as possible. In the meantime, I would like you to keep track of your symptoms and any specific triggers you might notice. It will help us get a clearer picture of what's going on.
All right, I will make sure to do that. Thank you, Doctor.
You are welcome, Mrs. Johnson. We will get to the bottom of this together. I will have my nurse follow up with you to schedule those tests.
Thank you, Doctor. I appreciate your help.
Before you go, is there anything else you would like to discuss or any other symptoms you have been experiencing?
Thank you, Doctor. I appreciate your help.
I'm glad you mentioned that. Stomach discomfort could be related to a variety of factors, including diet, stress, or underlying gastrointestinal issues. It's important for us to address this as well. Have you noticed any specific foods that seem to trigger this discomfort?
Actually, now that you mention it, I have also been having some stomach discomfort after meals. It's nothing severe, but it's been happening consistently for the past couple of weeks.
I see. We will definitely need to explore this further. I will add some additional tests to evaluate your gastrointestinal health along with the other tests we discussed earlier. It's possible that there could be a connection between your stomach discomfort and the headaches, dizziness you have been experiencing.
Not really. It seems to happen regardless of what I eat. Sometimes it's just a mild feeling of bloating, and other times it's a bit more uncomfortable.
Of course, Mrs. Johnson. Your health and well-being are my top priorities. I will make sure we thoroughly investigate all of your symptoms to provide you with the best possible care.
That makes sense. Thank you for taking all of this into consideration, Doctor.
You are very welcome. Don't hesitate to reach out if you have any questions or concerns before our next appointment. In the meantime, take care and try to get some rest.
I really appreciate that, Doctor. Thank you again for your help and attention to detail.
Absolutely, Mrs. Johnson. I'm here to support you every step of the way. Remember, if you experience any worsening of your symptoms or develop new ones before our next appointment, don't hesitate to contact me or seek medical attention.
Thank you, Doctor. I will do my best. Take care as well.
That's great to hear. It's important to approach your health concerns with a thorough and systematic approach. Together, we will work towards finding the answers and getting you on the path to feeling better.
Thank you, Doctor. I will keep that in mind. I'm feeling more hopeful now that we are taking a comprehensive approach to figuring out what's going on.
You are very welcome, Mrs. Johnson. It's my privilege to be your physician. Let's stay in touch and continue this journey towards better health.
I trust your expertise, Doctor. Thank you for your dedication to helping me.
You too, Mrs. Johnson. Take care, and I will see you soon.
Agreed. Thank you once again, Doctor. Have a good day.
Good afternoon, Mrs. Johnson. How have you been since our last appointment?
Hello, Doctor. I have been doing all right, thank you. The headaches and dizziness seem to have improved slightly, but I'm still experiencing some stomach discomfort after meals.
I'm glad to hear there's been some improvement with your headaches and dizziness. Let's discuss the stomach discomfort. Have you noticed any patterns or specific foods that worsen the symptoms?
It's still a bit unpredictable, but I have noticed that heavier meals tend to trigger more discomfort. Also, I have been experiencing some acid reflux lately, especially when lying down after eating.
I see. It's possible that you're experiencing some gastrointestinal issues such as acid reflux or gastritis. These conditions can often be managed with dietary modifications and medications. I would like to prescribe a proton pump inhibitor to help reduce the acid production in your stomach and alleviate your symptoms. Additionally, I will refer you to a gastroenterologist for further evaluation and possibly an upper endoscopy to assess the health of your esophagus and stomach lining.
All right, doctor. Thank you for your guidance. I will start taking the medication as prescribed, and I will follow up with the gastroenterologist.
You are welcome, Mrs. Johnson. It's important to address these symptoms comprehensively to ensure your overall well-being. Please keep me updated on how you are feeling and any changes in your symptoms.
I will, doctor. Thank you again for your thorough care.
It's my pleasure, Mrs. Johnson. Remember, I'm here to help you every step of the way. Take care, and I will see you at your follow-up appointment.
Take care, doctor. Goodbye.
Goodbye, Mrs. Johnson. Hello again, Mrs. Johnson. It's good to see you. How have you been since our last appointment?
Hello, doctor. I have been doing much better, thank you. The medication you prescribed for the acid reflux has been helping a lot. I have also seen the gastroenterologist, and they performed an upper endoscopy. The results showed some mild inflammation in my stomach lining, but nothing too serious.
I'm glad to hear that the medication has been effective and that the endoscopy did not reveal any major concerns. It sounds like we are on the right track in managing your gastrointestinal symptoms. Have you made any changes to your diet or lifestyle that have contributed to your improvement?
Yes, I have been following the dietary recommendations provided by the gastroenterologist, such as avoiding spicy and acidic foods, eating smaller meals more frequently, and not lying down immediately after eating. I have also been trying to manage my stress levels, which I think has helped as well.
That's fantastic to hear, Mrs. Johnson. It sounds like you have been proactive in implementing the recommended lifestyle changes, which can have a significant impact on managing gastrointestinal issues. I'm pleased to hear about your progress. Are there any other concerns or symptoms you would like to discuss today?
No, I think that covers everything for now, doctor. I just wanted to express my gratitude for your excellent care and support throughout this process.
It's my pleasure, Mrs. Johnson. Your health and well-being are always my priority, and I'm here to support you in any way I can. Please don't hesitate to reach out if you have any questions or if there are any changes in your symptoms.
Thank you, doctor. I appreciate your continued support. I will be sure to keep you updated on my progress.
Sounds good, Mrs. Johnson. Take care, and I will see you at your next follow-up appointment.
You too, doctor. Goodbye.
Goodbye, Mrs. Johnson.